This talk is about diffusion MRI for brachial plexus injuries. Traumatic plexus injuries are uncommon, affecting approximately 1% of major trauma cases, although they're devastating for patients and expensive for the health service. To guide their management, surgeons are interested in whether or not there is a root avulsion, or at least they want to be able to differentiate this from extraforaminal injuries. That's because injuries to the spinal nerve roots are the most prevalent form of injury, and they require early nerve transfer. To facilitate early surgery, scanning is often used in the acute phase, but pre-op MRI offers modest diagnostic accuracy, which is not sufficiently reliable. To fill this void, in Leeds, we have been experimenting with diffusion MRI for several years. In a vacuum, water diffuses isotropically, randomly. But the body is not a vacuum. It's full of compartments, spaces, and tubes. And this is particularly relevant for nerves, which are fundamentally highly ordered tubes. And the diffusion of water within nerves is equally highly ordered, preferentially going up and down the tube, rarely straying beyond its biological compartment. We can exploit this phenomenon in MRI, and I'll explain how. Here's the water in your body. It has a magnetic dipole. When we put you in the bore of the scanner, all your dipoles line up along the bore of the scanner. When we apply an RF pulse, their axis changes, and this generates current, which we can measure. Over time, they relax back, or at least they relax back at different rates, and we can time the measurement of this current to be sensitive to different tissue properties. If we time it to be sensitive to water v fat, this is a T1 weighted image. Or perhaps we'll jig the timings to be sensitive to water versus soft tissue, a T2 weighted image. So how does this apply to nerves? Well, it doesn't very well. Here's the water inside a fictional or artistic impression of a nerve. This is what happens when we put you in the MRI scanner, apply an RF pulse, and wait. Everything relaxes at the same time, and so we get no contrast. That's because the T1 and T2 and T2 star properties of peripheral nerve, skeletal muscle, and fat are extremely similar. This is where diffusion weighting comes in. Let's take the same nerve with the water in and around it. Let's put it in the scanner, apply an RF pulse, but now let's add in a diffusion sensitizing gradient. I won't explain exactly how this works, but effectively, it selects out signal from water which has hindered or restricted diffusion, such as the water that's contained within a highly ordered structure like a nerve. If we repeat this process hundreds or better still thousands of times, we can null the signal from other places and generate contrast between nerves and other structures. But much more than this, we can build up a 3D vector of the diffusion of water, which is called a tensor. Long, thin tensors imply diffusion which is bidirectional, up and down the nerve, as we might expect. A spherical tensor implies chaotic diffusion, as might occur in the connective tissue around a nerve. We can also join up highly anisotropic neighboring voxels with line segments. Clearly, we constrain these to ground truth of biological or anatomical fact, and we can generate things like this, which are tractograms. This is the spinal cord and the brachial plexus. Now just remember that every pixel in this image contains detailed information about the 3D movement of water, i.e. its microstructure. We've shown that this technology is sensitive to chronic root avulsion, whether it's a few roots or a panplexus injury. And if you'd like to learn more, you can find our paper published in Frontiers in Surgery. We're testing this technology prospectively in a cohort study in the north of England, funded by the National Institute for Health Research. Research of this magnitude clearly takes many people to make it a success, and I'm enormously grateful to everyone shown here. If you'd like to know more or support the work, then please do get in touch anytime. Thank you very much for listening.